Welcome to Spill Your Milk, the podcast where infant feeding, lactation, and orofacial development come together in insightful yet casual conversations.
We're your hosts, Nicole Edwin and Kayla Richardson, speech-language pathologists and international board-certified lactation consultants.
We're here to help you navigate the world of infant feeding, airway health, and holistic wellness. Whether you're a seasoned parent, expecting your first baby, or a professional working with babies, this podcast is for you.
From breastfeeding and bottle feeding tips to developmental feeding and body work, we're tackling it all. Plus, we'll share some real stories from families and interview experts across the field.
So take a deep breath, settle in, and let's spill some milk. Good morning.
Good morning.
How are you?
Fantastic.
Me too. So we're going to start by telling our own stories, right?
Mm-hmm.
Yeah, as like moms.
Right? Because we're moms first.
Yeah, and not these people who have all of this feeding knowledge, because the truth of the matter is when this all went down for us, except for your very last one.
Well, not my last one. I had help with my later babies.
Okay.
Yeah. But I have the dream team right now.
Yeah. Yeah, so there's a progression there. So let's start from the beginning for you, because you have 5 kids.
I have 5 kids. I have so many, and I love them.
So let's start by talking about Kylie, your first.
Yeah, so my first, she's 16. Oh my gosh, she's 16.
It's wild that you have a 16-year-old.
A 16-year-old and a 7-month-old. Yes, I do.
Yeah, so tell me, she came.
So she was easy peasy.
Oh,
I mean, she still is, though.
yeah, that's so true.
Yeah.
They are who they are.
Yeah, she totally came into the world the way she is. I mean, now, don't get me wrong, I had feeding challenges with her, but honestly, like what happened with me medically was what was like the ultimate determiner of like how long we were going to do this thing. So I would say young. I was 25. It's not that young. But I was actually diagnosed with thyroid cancer when I was pregnant with her. And so um, I had talked to like my surgeon, endocrinologist, like all of these people that were involved in my care. I was just getting out of the army. And uh, I remember saying, hey, I really have this, I want to breastfeed. It's like this strong, very innate urge. Like I didn't grow up with breastfeeding. I mean, I was breastfed for some amount of time, but I didn't have any exposure myself to breastfeeding. It was just like very much this innate thing for me.
Yeah, you wanted to do it.
Right. And so I remember sitting down in my doctor's appointment being like, I want to breastfeed as long as you'll let me. So I had her. 1 month later, I had my thyroid removed. And of course, this is at the VA, and which is wild because I'm freshly postpartum and my mom is bringing this newborn up to feed. Nobody said anything about my medications. I don't think we looked into my medications. It was just like, feed your baby. I didn't pump and dump. I don't remember any of that stuff. Maybe I did. I don't know. And everyone was enamored with this newborn on the floor because this literally never happens.
Well, I was going to say, of course, like that's not the environment that you would expect to see this sweet little newborn baby in.
Right. So we were the prime room. And so I was actually able to breastfeed her for about 4.5 months, but it was always combo. She did cause pain. I did use a nipple shield for a while, but she was always combo fed from the get-go. So I didn't know I had low supply or anything like that. That was never a concern of mine. She breastfed as much as she could. She also formula fed. And then before I had radiation, I had to stop breastfeeding. And so that was like cold turkey.
Well, what led you to offer, like, do the formula as well? Like, what led you to combo feed?
I don't know. It wasn't like she was hungry.
Yeah. You had a low supply and you didn't know.
Correct.
Which, the thyroid connection to that, like, I mean, that makes
Right?
total sense to us, right?
Oh, totally.
Also, it's just like, probably in that situation, of course, your medical situation at the time was like high priority, right? That piece of that wasn't like rattling around in your head of like, you're just going to feed your baby because
Exactly.
we're like getting through this big thing.
Right. And my surgery was really long, and it wasn't like, oh, I'm going to pump and prepare for this. It was like, here's the formula, mom, you got her, you know, because her dad was still active duty. And so he wasn't around at the time. And so it was just, it's me and my parents.
Yeah.
So that was, I mean, honestly, that's the extent of it.
Yeah.
But you know what's really cool? Side note, I have since worked with moms in the exact same situation, and we have protected their milk supply and continued to breastfeed after that. And I was like, oh man,
Yeah. But again, like we just said, you didn't you didn't have that level of support.
not even close.
And like even the fact that as a clinician, you're like have been there,
Mm-hmm.
that helps
Mm-hmm.
for those parents who are coming in that same situation. You're like, hey, like we
We
got
got
this.
this.
Oh, so that's really cool. That's like a
Yeah.
cool little connection. And even it's so funny because earlier when we were kind of talking about doing this episode, you were like, well, I'll talk about that one, but it's pretty, there's not a lot to it, but like that's huge. Like you had cancer.
It was short. It's no big deal.
I think
Isn't
what
that
you meant was
ridiculous?
just like not complicated, like in the sense of like figuring out what was going on because you had this huge thing and it kind of lends to this like what we are always saying is just like, we don't like that like breast is best or fed is best conversation because there's so much nuance to that of like your current situation while you were going through that. Like, yeah, the priority was you
Feed your
needed
baby.
this cancer treatment and your baby needed to be fed,
Mm-hmm.
period.
Yeah.
There's
You
no
know,
shame,
she's,
there's no guilt, there's no, like that is just what the situation was. And you
yeah.
did that. You beat the cancer and you fed your baby.
Mm-hmm. Now she goes, I'm the only one of you that's formula fed.
Shut up.
She doesn't like it. She's fine.
She is 100% fine. She's thriving.
Right? She's incredible.
Yeah, she's so cool. I want to be Kylie when I grow up.
Right?
I love
I
her.
know.
Okay, so then how long, Alex, you're next.
So he's 4.5 years later.
Okay, so I was going to say, then things got a little more
Yep.
complicated with Alex,
Right.
but like what, you had some time in between there.
Well, I was in school, grad school. So, like, I got out of the army, went full on. I mean, I had Kylie and I was in school, and so we waited until I was finishing grad school to have Alex. So I was in school, but like at the end of grad school when you're already working,
Yeah.
it's fine. It's perfect time to have a baby. Which was kind of cool because, like, whenever we go to class, we just pass the baby around because he came out with me.
Yeah.
So it's kind of like now where I bring the baby to work.
I need to interject on like how hard speech language pathology
Oh
grad
my
school
gosh.
is. So again, you had a child, a young child. You had already had cancer and like beat that, gone through cancer treatment,
And was back from Iraq
and back
not
from
that long
Iraq.
before.
My husband's, deployed for part of this. And then you're like in grad school, which
He
seriously,
was out by then.
I know, but like seriously, like that 2 years of grad school is like if you talk to any speech language pathologist who has been there, like it's awful. It's so hard.
I'd never do it again.
No, no, me neither. I'm so glad I'm done with it. But I'm like, and then you're like, I'm gonna have another baby.
I mean, if you know me, this is on par. Wait, what's the word? Is that right?
Yeah, it totally is. You're like, it's fine, we'll get it done. So
How can I
you're
overfunction some
grad
more?
school, you're at the end of grad school, and you have
Yeah.
Alex.
Yeah. So, and there's no maternity leave then either.
Absolutely not. You get
So
your
I'm like
assignments done, girl.
I'm literally bleeding from everywhere. like my nipples, and and like march back right back to class. Jesus. This is almost like therapy.
I know.
You
I know,
forget
because
these
you're like,
things.
what?
You forget these
But
things.
also, you should be like, I did that. That's
Yes.
good job.
Okay.
Proud of you.
Thank, thank you so much. So he was just past his due date, just barely. And I'm not doing any of the things that I do now. Didn't have any prenatal chiropractic, didn't have a team. I was already outpatient pediatric speech therapist and had him tore me apart. I mean, his birth was intense. I say he was born a freight train, never stopped. I think he's starting to slow down now. He's 11. And he was just such an angry baby. And now knowing what I do, like his birth presentation had so much to do with that.
Which was OP. Yeah.
OP, right. He was sunny side up. And if I had the team, or if I knew what I do now with him, oh my God, he would have seen the chiropractor day one.
Well, yeah. And I know you have said before, you're like, well, you just kind of said it. You're like, I wasn't doing any of the things that I'm doing now. So, like, you take very good care of your body now, right? Like, you
Oh my gosh.
consistently get chiropractic adjustments, you're doing other soft tissue body work, you like really take care of yourself, but you didn't really know to do that back then. And so,
No,
you feel like if you had known what you know now, like during pregnancy, you would have gotten some of that treatment, which maybe you would have even resulted in him not being sunny side up.
maybe.
Maybe, we don't know.
Mm-hmm.
But then he comes, he's delivered that way. And we know now the impact that that likely had on his body and that
Mm-hmm.
that likely was having on his latching abilities.
Oh my gosh. And that's separate of him being profoundly tied,
Yeah, yeah, the tongue and lip tie.
tongue and lip. Well, and honestly, I didn't even know about buckle ties back then. And well, I didn't know about anything back then, to be very honest. But he has since got his buckles released when he got expansion at 8. So he had all of them. Hmm.
It's
He
a
was
really
so
good
angry.
reminder though that like you can only do what you can do with the information that you have in the moment. And that's what you were doing. And you are going to
Yeah,
tell us about how
absolutely.
you made it work.
Yeah. So the silver lining is we went on to breastfeed for 2 years. How we did that? Oh boy. So he was born really, really big. He was 9 pounds 9 ounces. He was born angry and he was born hungry. And he dropped weight really, really fast. It was excruciating. Okay, so I've said this to families, and I think it's really important to say this out loud to everyone. I had so much pain with breastfeeding. It took everything for me not to throw my baby across the room every time he latched.
I understand that deep in my soul.
Right? Nobody wants to say that out loud.
It is the worst pain.
And we do it every hour, 2 hours. We definitely didn't go, that baby fed every 2 hours or more for 2 years.
Mm. Yeah.
Of course, it didn't, the pain wasn't for all that time, but
And but were you because sorry, I think that we have discussed this before, you and I, that it was just like innately something that you wanted to do. You wanted to breastfeed your baby. And even though you were having all that pain, you were like, we're doing this.
oh my gosh, absolutely.
That's how I felt too. Yeah, that's how I felt when, yeah, and
Yeah,
we'll talk about my situation, but like that's exactly how I felt.
yeah.
No one was pressuring me.
Nope,
There
just
was
myself.
nothing external being like, breast is best and you have to breastfeed your baby. It had absolutely nothing to do that. It was just innately, this is what you wanted to do.
Hmm.
and you were going to do it.
Yeah. Well, and I didn't get a chance to do it with Kylie.
Yeah.
So it was like that much more drive.
Yeah.
But I remember very quickly walking into the pediatrician's office. It was probably his 2-day visit for all I don't know. Sometime very soon. Maybe it was his 1 week. And he had dropped a lot of weight. Now I know I chronically have a low supply with all of my babies because we can look at the objective data with everyone. And basically felt like I was starving him based on what she told me. Probably was, but And going to the grocery store immediately after, standing in front of this, what felt like enormous aisle of all of these choices of formula,
So
having no
overwhelming.
idea what I wanted to. It is. And I'd formula fed before this. But like that wasn't my goal. That was not my intentions. That's not what I was there for. I was there because my baby was starving and I was failing.
Yeah, and
That's
that's
how
what
it
that
felt,
felt
right?
like, right? Like that's why it was so emotional. Like you're standing in the aisle and you're like, this is not my goal. This is not what I want to do. And so your brain can't even really like logically pick a formula, because you're just like, I don't want this.
Uh-huh. So I'm standing there just like, that silent tear rolling down the cheek moment, trying to hide it. Yeah. I bought the formula and I just sobbed in the car. And then I fed my baby. And then he was full.
And how did that feel?
Gosh, I don't even remember. It's probably deeply buried in there. But it was cool? Like, I have pictures now of his sister feeding him a bottle. And,
Yeah.
like, that was the most incredible thing for her. So, like, I just all of a sudden had this, like, flash of these pictures that I've seen when he was a newborn and getting a bottle. And, like, he looked so thin then. But he was born in the 99th percentile and he aside from that short window, has stayed that until today.
Yeah. So he
So he's
clearly
just been.
needed that formula.
He did. Yeah. And what's really cool is I went on to fully breastfeed him and like fade out that supplemental bottle. No idea how I did that.
Because you
I
didn't have
also,
support.
well, I did go see a lactation consultant that
Okay.
there was there at the hospital. It's kind of like a free, go in and get help. And I still remember her standing over my shoulder and I latched him. And she goes, "Oh, that hurts, doesn't it?"
You're like, yes, ma'am, it
And it's
does.
like that moment that you just, oh, you know,
Uh-huh.
yes, it does.
How
I
long
said,
did the pain
and
last?
oh, I don't know. I don't even know. It was definitely not one of those like, does the pain last for 10 seconds and subside? No. I was already cracked and bleeding and yeah. And um the speech therapist in my part of my brain was going, I can like literally see myself doing this. It's like his tongue is going like this. And she goes, "Oh, well, we can't do anything about that." Whoa. And I think she sent me home with an SNS. She must have, because I used the SNS with system with him for a while, the supplemental nutrition system. So for anybody who doesn't know, so he got bottle with formula, but then I was able to also give him supplemental formula by the tube while he was latched to the breast, in which obviously that really helped my supply increase.
Yeah.
And I was able to, on my own, go from supplemental to just feeding him. Um, and I didn't know about ties, but he was very clearly tied and he had issues with his function. But that was when my brain started going, okay, you didn't help me. And this is hard. And I don't know what to do, but my scope of practice says I can do this. I just don't have the tools yet.
Yeah. Well, that conversation, I mean, gosh, what is he's 11, right?
He's 11. Yeah.
Yeah. So, I mean, my oldest is 10. So, yeah, like that no one was having that conversation. No one was having that conversation then. Um, but I love that that was like already the moment where your brain was like kind of like, what do you mean we can't do anything about this?
This is not right.
Yeah, because my brain did the same thing, and we are the same in that sense. Like, I couldn't let it go.
Right? No.
Like, we change function every day. What do you mean?
Right? We're not trees. Move.
No, especially in a baby. Like, neuroplasticity
Exactly.
is popping, you know? So,
Exactly.
yeah, it doesn't make sense. And it's so cool that even with, I mean, not that you had no support, good job going to go ask for help. But like that you did the SNS and then your supply increased because I think, I guess, explain that a little bit because I bet most people out there, first of all, I'd say that 90% of the people that I see where I suggest maybe using SNS as a tool, they're like, what is that?
And honestly, the SNS has been one of the most profound tools with all of my feeding journeys.
Yeah.
So I have become very proficient with it. And I understand how hard it is to start because I can't even tell you how much milk I literally spilled
Yeah.
with Alex in that tube.
There's such a learning process with it. I feel like I always lead with that. I'm like, listen, this is going to feel like a lot at
Yep.
first, but when it works and it will get easier. But
Yep.
I don't think even early on in my lactation career had really, I thought, oh, great, we can supplement at breast so that we're still getting that breastfeeding experience. But then
Exactly.
quickly, I was like, wait, all of that extra time at breast and all of that extra stimulation at breast should result in increased supply. And that's what happened.
Yep.
So it's like sometimes this is like a long-term tool and it's great because it helps us meet those goals at feeding at breast or chest, whatever that person's goal is. But many times I have situation like yours where it's like we can wean off of it,
Mm-hmm. Exactly.
especially after we've improved function.
Mm-hmm. Well, yeah. And so he was a compensator. He was really, really strong,
Yeah.
and super tied.
Yeah.
It's funny because I can look back at some of the pictures now when he was older. I'm like, oh my God, look at that.
Yeah. Yeah.
Ooh. And so I think it was when I started, because I didn't know what ties were, but I started doing some research and I didn't find it in the speech field, but I found it in the lactation field. And I went to my pediatrician and was like, hey, I think he's tied. Nah, I don't, I just got dismissed. She's a good pediatrician and I really liked her. And she didn't like entirely blow me off, but I definitely didn't get hurt. And nothing was offered for help other
No other
than I needed to give
solution.
him formula.
Yeah.
No. What's interesting is one of her kids was released too. So, and I didn't find that out until we finally did get the support we needed. And so what was happening when I was finally took serious was when he was 8 months old. He was 8 months old and he was leaving tooth prints around my areola after feeding,
Oh,
all the way around. I was like, what do we do here? Like, I wasn't in pain anymore because, babies figure it out, but that doesn't mean they figured it out well. They just worked around the roadblock.
yeah. Well, and probably some of it was like being contributed to by his birth presentation and some of that tension that he was holding. And so as he got older and he started to move, some of that released on its
Yep.
own. So
Right.
probably as time passed and that happened and he opened up a little bit, the pain was not what it was at the very beginning. but he was still definitely compensating. Obviously, those teeth came in and you were
Absolutely.
getting tooth marks. Like,
Yeah, because
that's
there's
not a
no
good
more
latch.
room. Like,
Yeah.
right? The mouth can only open up so far, so the teeth are now really getting in the way. So I was sent to an ENT down in Springfield, Missouri, and we did the consult. He said yes to the lip, never even looked at the tongue. Put him under general anesthesia
No.
for a lip release. Yeah, I had no idea. I didn't know better. They walked away with my baby. And of course, it wasn't on the same day. We had to go back. And I mean, he was an older baby at that time, but it's like, and he came back quickly in the grand scheme of things. And the latch was 100% immediately better, like entirely pain free. Deeper latch. It was incredible. I didn't care that he went under general anesthesia. I didn't care about shit. That
Oh,
felt
yeah, you're
good.
like 8 months in. We've been in pain this whole time. Now I have tooth
Mm-hmm.
marks on my areola. Like, worth it.
Mm-hmm.
But like, that's
Yeah.
crazy. Cause, and honestly, the crazy thing is like, this is still happening. Like,
It's still
people
happening.
are, it's still happening. Like, people are still kind of getting dismissed by their general practitioners. And like, I'm
Kinda.
probably too nice. Yeah, like, I'm probably too nice. I'd like to like give them grace of like, they're using the information that they're being given,
That's
that they were
true.
trained with, and that's generous because I do think as a medical professional, it is your duty to kind of keep up with the research and learn these things. But
Mm-hmm.
it that definitely still happens. I think it's happening less. I do, but it's
I
definitely still
agree.
happening. And then there's this conversation about, oh, you have to go see an ENT. And then that, like, these babies are still, like, I still hear this story that, like, they said that we have to put them under general anesthesia to release this tie. And I'm like, no, we don't. No, 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 no. But on top of that, I am still hearing because of where we are with the research on ties. Well, we don't really have a lot of good research to support releasing the lip, just the tongue. But we know clinically what we see. And your story, although anecdotal on its own, only the lip was released. And immediately
Mm-hmm.
that pain was gone. He was
Yeah.
no longer biting you. So
Yeah.
we still have a ton of research to do. That is true, but I'm not waiting for that.
No, we see way too much in the clinic, and we can put so many pieces together and not need any research to guide us. I'm sorry.
Yeah. Yeah.
That's enough
So,
research for me.
yeah. So he came back. That was immediately better. And then no hiccups from there. Like you guys went on.
Oh, yeah, we went on to breastfeed for 2 years.
That's amazing.
Yeah. Yeah. I mean, no speech issues. He ended up getting expanded when he was older. So he was 8. We did buckle releases and his tongue tie release. We waited all the way until then.
Never too late.
Oh no,
It's
never too
another
late.
thing we say all the
I was
time, isn't it? It's never too late.
yeah, I was 36 years old when I got my release done.
Yeah, me too. Me too.
Is that how old you were?
Yeah, that's funny.
Wild.
Yeah. Yeah, I always tell people, I'm like, the work is different as we age. You know what I
It's
mean? The
totally different.
surrounding
Yeah.
work and everything we need to do to support that changes, but it's never too late.
No, I agree. The oldest person I have worked with that's been released was 82 years old.
Yeah. I mean, I bet your nipples wish it had been done sooner.
I still have scars.
I bet you do.
Yeah. Yeah. But like at the same time, when you go through stuff like that, I wouldn't change one step of that. I wish I didn't go through any of that. But look where we are now because of
Yeah.
that experience with that child with that lack of support.
Yeah. And so was it after him that you started to like dive in?
Oh yeah,
Yeah.
big time. The first thing I went into was just feeding therapy in general. I kind of went big and then laser focused, which, every piece of that puzzle has is helped with every patient I've ever worked with.
Yeah. Yeah, you can't only have that specialty and not have done that other stuff. It doesn't make as much
Yeah.
sense.
Yeah, yeah, exactly. And I finished my lactation training before I had my third, which was only 20 months later.
Yeah, you're right. I mean, and I think your story is going to be a familiar one to a lot of parents out there that like I was in pain. I mean, you had that thing and I had it too where I was just like, we're doing this. Um, but it would have been valid for you to be like, we're not doing this
Right.
because you asked for help. You saw lactation. You asked your
You're like, can't do
pediatrician
this.
very specific questions, and the only solutions were to continue to breastfeed your baby in pain or give him a bottle.
Mm-hmm. Mm-hmm.
And it's like, how are those the only two options? And
Right.
how, you know, normal anatomy, normal physiology, the ability for a baby to latch is normal. So when that's not going right, and this is what
There's
your and
something
I
wrong.
brains were like thinking, there's something wrong.
Mm-hmm.
There has to be something wrong. There has to be some sort of
Correct.
dysfunction because if you give that same example anywhere else, okay, I always use the big one, if your baby's not walking when they're supposed to be walking, everybody's asking why. You got to go to PT. Why is this not happening? And like that latching, that breastfeeding is the very first developmental milestone. And so it's like to not question why that's not working is crazy to me.
I couldn't agree more.
Like it's
And that's why we're
insane.
here.
It totally is.
We
And
don't,
yeah,
we are unwilling to accept that.
yeah, very interesting. I've never heard that story from you before. That was fresh for me.
I love that.
I know. I know, because I know we both we're like, we've come from a similar situation.
Really similar. Yeah. And how we developed was very, very similar.
Yeah, but like even when we met, I think it was just like, oh yeah, I really struggled. And then this led me to this. But I don't
Yep.
think that we have ever sat down and like really dug into our own stories before. So this is fun. This is going to be
We
fun.
haven't. How cool is that? We get to do it now and other people get to hear it and benefit from it.
I know. And like, thank you because again, it's so important that our listeners are hearing this because somebody out there just heard that and was like, well, this sounds like exactly what's going on with me. And I also saw this person and this person, and I have also been told that I can either switch to formula, which if that's what you want to do, go for it. I understand it hurts. That hurts.
Yeah.
Um, but someone else is out there being like, what? Like, I really want to do this.
Right. And you're not selfish for either decision. Because
Yeah.
I've heard that comment like, am I being selfish for trying to make this
Oh,
work? No. No.
yeah.
Am I selfish for wanting to stop? This is too hard for me. You are not selfish. No.
No. But thank you for sharing because that's what we need. I need more people to be talking about what has happened to them. Otherwise, we are
Yes.
not going to make a change. So thank you for being so willing to like share that because I mean, it's being shared in a very like storytelling way, but like we both know is very traumatic.
Absolutely.
Yeah.
Right? That's why some of the things kind of get blocked up, and that's why it feels almost like therapy because it's like, oh, I've forgotten about that, and it just comes up.
Yeah, because even when you're like in a session with someone and you're like, oh, like this happened to me, and like I totally understand how you're feeling to like,
Right.
connect and relate. Like you're not going to sit here for a full, 35, 40 minutes of your session and like hash out every little detail of it. Like for me, it's usually like,
No.
yeah, I had a lot of pain too. I was in pain, bloody, like I get it. Like I know this pain. Here's what we're going to do differently. Um,
Yep.
but you really don't get to hash it out in detail like this. And I'm sure and we haven't done mine yet, but I think it's probably very healing to like kind of revisit that and see how far you've come
Yeah.
and look back on like, man, you did that. You made it through. And now you're
Right.
helping tons of other people.
I know.
So what's
It's
your
incredible.
takeaway for everybody?
Uh, my biggest takeaway, I think, genuinely, is to not accept what doesn't feel right.
Like
Because there
trusting
is
your
somebody out
instincts.
there. Absolutely. I'm sorry, but like women's instincts, your instinct as a parent is so accurate.
Yeah.
And we get told all the time that it's not. Or like, your first time mom, it's fine. You'll figure it out. Like, no.
Yeah. My takeaway from what I just heard you say is keep looking for the right support, which I guess you kind of just said that, but like
Hmm.
your story here is an interesting example of like because I'm always like going off about well like you got to ask for help, you got to get support, and you did,
Right?
but it wasn't the right support and it wasn't enough support. So if you are out there struggling with feeding at all, not even these specific symptoms, keep looking. Someone out there is the right support for you.
Yeah. And you know what? Maybe reach out to us if like you still don't have that person. It doesn't have to be us. Like we're really
Yeah,
good
we
at
have
finding the
connections.
people. Oh my gosh, we have so many connections. And like if you still don't know who to see, like find a link below
Yeah,
in the
for
notes
real.
and like we'll get you connected with the right person.
Yeah, yeah. Okay. Well, thanks for sharing.
Thank you.
We'll be back again soon. We'll hash out some of my stuff next.
Hmm. I'm looking forward to it.
Me too, I think. All right. Bye.
uh, Thanks for tuning in to Spill Your Milk. We hope today's episode brought you some clarity, comfort, and practical tips for your feeding journey.
Don't forget to subscribe, leave a review, and share this podcast with fellow parents and professionals who might need a little extra support.
You can also follow us on Instagram at Spill Your Milk Pod for more tips, resources, and behind-the-scenes content.
Until next time, remember, every drop of effort you're putting in makes a difference. Keep spilling your milk, and we'll see you soon.